Marketplace plans, what are we talking about? ACA, when is open enrollment for these plans?
Yeah, so open enrollment for a January 1 start date is going to start November 1st and will go through December 15th. And then from December 15th to January 15th, you can still apply, but it will be a February 1st start date.
Good.
So you really want to get those applications in by December 15th.
Yep.
Yeah.
So you're good to go the first of the year, and
Yeah, you can have a full year of coverage to help you meet that deductible.
get those ID cards in by the first of the year, so you're rolling. So what is an ACA Marketplace plan?
So a marketplace plan is one that you cannot be denied for pre-existing conditions, which means there's no underwriting. Marketplace plans also cover preventative care, and you can also qualify for a premium tax credit, which is a subsidy that will help pay your premium, which means that potentially you're not paying the full price, which is really nice. Those premium tax credits are based on household size, income, and zip code.
Also, on those, they are graded. So, you could qualify all the way up to a certain amount, dollar-wise, income-wise.
Mhm.
It just depends and fluctuates. So don't think just because you make a certain amount, I'm not going to qualify. It's always great to check
Yeah,
with us.
and those are based on the poverty charts that the government puts out, which has not been released for 2025. So once those are released, we can post them. That way everybody can kind of get a look and see where they're at on that.
That's awesome. So going into those plans, most of them, if not all, are either PPO or HMO plans. So what does that mean for you?
Right, so if it's a PPO plan, that means that you have in-network coverage as well as out-of-network coverage. You want to stay in-network with your providers or your healthcare system, so your doctors, your hospitals, your clinics. So if you're in-network, then you pay less for your coverage. However, since it's a PPO, you have more access and you can go out of network if you want to, and that is how a PPO works. So maybe a little more access with a PPO. An HMO, you must stay in network. Your healthcare system, hospitals, clinics, doctors, again, must be in network for there to be coverage. If there is an emergency and you cannot use an in-network provider, then the plan still has to cover you as though you're in network. So in that way, HMOs do work for people, and you usually pay a little lower premium and sometimes get a little more coverage on an HMO because of it. Also, there are health savings account eligible plans on the marketplace. So if you do have a health savings account, let us know if you're interested in those plans, because we can look at those plans for you too. There are individual health savings account HSAs available on the marketplace as well.
Yeah, I think another important thing to point out with that HMO is they do require you to pick a PCP, which is a primary care physician, and if you don't pick one, they will pick one for you.
Right.
So when we do these enrollments, if that's what you guys decide to go with, that is something that we will be talking about and trying to get assigned to you.
Yes.
And you can change the your primary care provider if they do pick one for you. So don't worry, but it is better to have select one when you enroll.
And that primary care provider is going to kind of be a gatekeeper of the path and specialist that you go to. So they will have to refer you to a certain specialist if you need to see one. So they kind of, direct you where they think you will be best suited in your health.
Yeah. So what about the carriers? What carriers do you have in the market this year?
So expected for 2025, we are looking to have Ambetter, Blue Cross Blue Shield of Oklahoma, Community Care, Medica, Oscar, Taro. They'll come back for their second year in the market in Oklahoma, and then United Healthcare. We are anticipating changes with some of these carriers, so it's going to be really important to schedule those one-on-ones with us to kind of go over your current plans. Even if you're happy with them, just let's make sure that your providers are in network. They're still the same benefits that you're happy with today, so that's going to be very important this year for 2025 plan years to go over. And then we are really excited about one of the carriers this year. We really think that they're going to be pretty spectacular, and we hope
Making a big splash this year,
yeah,
we hope.
yeah, we're excited. But because of those changes, we do think that it's going to be really important this year to look at adding supplemental plans to your healthcare portfolio, just to cover those gaps that that could be there in 2025.
Yes, it does. It covers gaps, and it also provides income replacement. So if you're not able to work and you're not receiving a paycheck, then the supplemental coverage, which is usually very reasonable premium, can help with the income to pay your bills. So yeah, we can definitely help with that.
Yeah, and then we also have some new rules that are coming.
Oh, yes.
We want to talk about those new CMS rules that we have.
Sure. So Centers for Medicare and Medicaid Services, CMS, have implemented new rules for 2025, and what those are, it's really just to protect you and your health plan and make sure that you stay in the health plan that you enrolled in for 2025. So what they're going to want is, number one, we have to have consent to talk to you about your application to look at plans. So we'll be sending, an electronic DocuSign to you just to sign off saying you do give us permission to talk about these plans, go over your personal information. And then if we do get to the process, or when we do get to the process of enrolling you, before we hit that enroll button, there is a new rule saying that we do have to go through the entire app and make sure that all the information that you've given us is what you expect to be true for 2025. And then we'll either record that section on our end, or again send you a DocuSign just to sign off saying, yes, we did go over all of our income, the household size, we're currently living in this address, and this is the plan that we are expected to be enrolled in 2025. So it really just kind of crosses all the T's, dot the I's, and make sure that there's smooth sailing into the 2025 plan year.
Yeah, and with that too, if during 2025, if there's an update that needs to be made, we will have to go through that process again.
Right.
We understand that it's kind of
Tedious.
obnoxious
Yeah.
and tedious, but it really is to protect you and make sure that nobody else is accessing your information.
And it really doesn't take long.
No.
Yeah.
It's not going to really add time to the meeting
Process,
or the
yeah,
process.
yeah.
But we just got to do it.
Yeah, for sure. I think it'd be important for us to finish this out by saying, what is the value in talking to us? What can we provide for them that maybe they're not going to get if they just go to the marketplace and do this themselves?
Sure. So the application process itself on the marketplace, healthcare.gov, it can kind of be confusing. You don't know what questions you need to answer, how to answer them. So it does get tied up. If you are able to make it through that process and you get enrolled, everything goes well, and in March you go to the doctor, a claim is not paid, then what do? It's really at that point valuable to have an agent that you can just call and say, this wasn't paid as expected, what do I do? Whereas if you were just to go to the marketplace, you're going to call healthcare.gov, and that's kind of a headache.
Yeah, or you may not even call them, and then you're just paying more than what you should be, and that's money out of your pocket.
Or you're calling the carrier, and now you're dealing with a rep that has to deal with their hierarchy. So that's where we just can cut through all of that and just help you one-on-one.
Yeah, we have those carrier relationships. We have our reps at the different carriers that we can go to for any questions, and just make that process as seamless and headache-free as possible.
And you're not paying any more for the coverage for our services.
And on top of that, we can maybe look at other plans that maybe aren't on the exchange that might be a better fit for you. So it really is going through an agent or our agency. It's customized just to you, and we kind of do that needs analysis through the process and really see what would benefit you the most.